So in the DawAI, we have a vision to help these people. So these people are either working for the government or different NGO organizations, and their main job is to decode these medical prescriptions to the rural public. So there are some NGOs, just like ASHA workers, where they are manually servicing some 10-15 families in rural villages, and they are making sure that people are adhering to their medications. So this is our first customers who we are going to target in our app DawAI. In long term, what we are going to do is we are going to go for these particular government medication adherence programs. So this is a 2016 manual error 99 dots program by the Indian government for tuberculosis medication adherence, where it's actually touching some 12 million lives. What they do is, this is a manual system where patients are given envelopes, and the envelopes have small, tiny telephone numbers, and every time the patient is taking the medicine, they're supposed to give a missed call to those numbers. As a result of which, you can understand it's a very high friction, literacy dependent, and manual process. On the top of that, the main problem with this is it actually doesn't understand that adherence is a different problem than someone just giving a missed call. It doesn't actually make sure that the person has adhered to his or her medicine. We, in the long term, is going to target this 430 million annual budget of Indian government, and leveraging DawAI and Gemini's multimodal reasoning, we are going to provide a solution which would be intelligent, inclusive, and life-saving, thereby having a 10x technological leap and saving the Indian government millions every year. The idea is, we are already doing the scan, as we saw earlier, in our DawAI app, together with voice and reasoning. Maybe there's a way in which we can figure this problem, and maybe we can solve it so that we are touching millions of lives and helping them in their recovery plan, not just as data points, but as survivors.